Hello, I'm Dr. Rodriguez from Schertz Animal Hospital, and today we're going to talk about arthritis. Generally, we see arthritis in our larger breed animals, but that doesn't necessarily mean that small animals don't get arthritis either. So what is arthritis? Arthritis is just inflammation of the joints, which causes pain, stiffness, difficulty walking, okay? Sometimes you will see the age of onset roughly between 5-6 years and above. In the aging process, as our furry friends get a little bit older, what happens is the synovial joints basically don't produce much synovium. And what synovium is the lubricant in the joint itself that causes us to have no pain there. But as time goes on, we have changes in the joint which causes inflammation. The way we normally diagnose arthritis is through history and physical examinations and also x-rays. Okay, so during our physical, what we normally do is we watch the range of motion of your pet. We walk them down the hallway, see if we see any limping. Other questions we also ask is, does your pet have difficulty sitting down or standing up, or difficulty jumping on top of the couches, negotiating in the backyard? Do you normally see them where they used to run real fast, all of a sudden they slow down quite a bit? So when we diagnose arthritis, we then manipulate the legs, the shoulders, all the joints to see if we can elicit a pain response. Then from there, once we're able to do that, we can actually go to x-ray, and when we x-ray your pet, then we look for changes that dictate what arthritis looks like. For instance, now we can look at this x-ray right here. As we look at this x-ray, we can look at the right side of the pet and the left side of the pet. And actually what we're looking at is the pelvis, the femurs, and the tibias there, or the knee joints or hip joints, okay? So if we look on the left side, that is more of a normal hip joint, and as we go to the right, we can see we have some changes there, okay? Now the other thing too, now we go down to the knees. The knees over here on the left side, you can see all this little bit of fuzziness, and that is what arthritis looks like on an x-ray. Now let's look at a model. This is a model of a pelvis, okay? So if we look closely, if you look here, you can see how well this joint fits in. It's nice and smooth. You can see the anatomy is normal here, okay? So now when we look at our arthritic joint, you can see the changes, how roughened it looks right there. And so when your pet walks and is going back and forth, all these little bumps right here, or arthritis, or these bony projections get caught, and that's what causes the pain. Once we diagnose your pet with arthritis, and if it's in the early stages, one of the products we recommend is a glucosamine type product that's used daily. As time goes on, 4 to 6 weeks go by, then hopefully your pet should start to be able to move a lot better for you. As the arthritis progresses and your furry friend is having difficulty getting up, sitting down, or running, then we move to our next category, which are NSAIDs, non-steroidal anti-inflammatories. Products such as Rimadyl, Medicam, Galliprant, and Duramax. And now for our furry little kittens, we have a product called Ensure that we use that will help them with arthritis too. The next subject we'll talk about is a multimodal approach to treating arthritis for your furry friend. Okay? So as time goes on, generally one agent usually will do the job, the next agent will do the job, but as time goes on, sometimes you had to have an additive effect. Therefore, that's why we call it a multimodal approach. So it is not uncommon to see a pet on glucosamine, an NSAID, and also the use of Adequan. The other modality we also treat with is laser therapy. And sometimes what we wind up doing is using all of these products together to get the desired effect for quality of life for your pet. One of the most common things I see with owners that come into the veterinary hospital and their pets have arthritis is that they tend to use the internet, and they will use ibuprofen, they'll use aspirin, which is a very serious no-no. So what I recommend is call us, your veterinarian, and let us talk to you and do an exam on your pet. Therefore, we could direct you the right way how to treat arthritis.